Organization is also said that the TB is on the rise again. And this is a setback because it is a curable disease. Of course, we're doing this in discussion with the backdrop, of course, of the COVID pandemic, but we must be cognizant of obviously diseases such as tuberculosis, which we can treat with the right investments and the right approach. As we said, TB is preventable, and prevention is better than a cure, and it's curable with affordable drugs, and of course, control effort and diagnosing cases quickly. Before we move in and I talk about the speakers, we'd like to compliment the Department of Health for its unwavering effort to reduce tuberculosis burden and respond obviously to the services needed through its national tuberculosis program. And one of the speakers today is Dr. Anna Garfin, and I will come to her in a second. And we're going to be very fortunate to get the update from her and her thoughts on the business. We have a very strong array of speakers. I will go through those now. And obviously, we're going to have a roundtable discussion, which will be kindly moderated by Matt Oliver. And I would again, of course, encourage as many questions because that's how we're going to get the most results from this in terms of having obviously a very well-defined debate. So first of all, I will go through quickly the speakers. So once again, thank you very much to Dr. Anna Garfin of the Department of Health for kindly being here. She's the current program manager of the National Tuberculosis Control Program under the Disease Prevention and Control Bureau under, as I said, the Department of Health. And she has more than 20 years experience of working on tuberculosis control. So obviously great experience. We look very much forward to hearing her speak. Excuse me for a second. We also have Dr. Lalaine Motorare, who's the Deputy Chief of Party and Private Sector Advisor, USTA, Tuberculosis Innovations and Health Systems Strengthening Project. She is a pulmonologist by training, and she trained at the University of the Philippines. She's also worked at the Philippine General Hospital and is a past chair of the Philippine Coalition Against Tuberculosis, and obviously brings great experience, and we look forward to her insights. I've already mentioned Matt Oliver. He's the project lead, as we said, for ending workplace tuberculosis, and he will kindly be leading the discussions later. He launched this in 2014, the Global Tuberculosis Caucus. It's now grown with over 2,000 members from Parliament, from 130 countries campaigning on tuberculosis, and culminating with the first ever United Nations high-level meeting on tuberculosis in 2018. So again, bringing great experience and insights to tuberculosis. We also have Ruth Brignall, PhD. She's the medical manager for Oxford Immunotech. So as I said, she's got a PhD in immunology and cell biology from the University of Manchester. Her PhD studies focus on adaptive immune responses. And obviously, she will bring together from her company base and her own experience, obviously working on tuberculosis advocacy and medical education. And coming finally, and certainly not least, again, bringing up a great experience is Rodera Buenaventura Snyder, manager of the Corporate Responsibility Department, Employers Conference of the Philippines. And she said she is the manager, and part of her key role with the Employers Confederation is the preparation of proposals and funding and working in close coordination with partners. And she has regularly conducted lectures on occupational safety and health, as well as other CSR initiatives related to the conference member companies. So I think, dear, I've covered all our speakers. We look forward to a very good presentations, and above all else, coming up with how we can all move together on continuing to eradicate the curable disease of tuberculosis. On that note, I shall kindly hand over, I think, to is either Dia or Matt Oliver, and I wish you all a very good discussion, and I will say a few words at the end. Thank you very much.
Thank you so much, Chris. Now may we call on Dr. Kerfin.
Thank you, and good afternoon and good morning, everyone. So I'm here to present the burden of TB in the country and what we have done so far. So can you see my slide?
Yes.
Okay. So first question, why bother about tuberculosis? Why do we need to address tuberculosis despite the COVID-19 pandemic? So if we look at the data, and this is the 2020 data of the WHO, it would state that the leading cause of death in the lower middle income countries like the Philippines, tuberculosis is one of the leading cause of death. And according to the Global TB report just released last week, approximately 1.5 million people died from TB in 2020, and this is higher than in 2019, and it's the first time that there's an increase in the global TB deaths in more than a decade. Our objective really is to decrease the number of TB deaths. So in the Philippines, why do we need to address tuberculosis? So based on the WHO, Philippines is one of the 30 high TB burden countries, and they have released a map wherein 8 countries that rank first to 8 in terms of the number of cases, and that accounted for 2/3 of global cases in 2020. And Philippines is included, and in fact, we are contributing 6% of the total TB cases annually, and that is in the global situation. Okay, so next is let's look at the incidence of the TB in our country. So the green line would show the incidence rate. So initially it was high, then it decreased, and there was a slight increase from 2015 up to 2019, and a slight decrease for 2020. But what is good about this is we have improving notification of TB cases, because once we know where the TB cases are and we put them on treatment, then the transmission would be stopped. But the sad thing is with COVID-19, the case notification rate decreased by 40%. That is last year. In terms of mortality, there's also a decreasing trend for the past years. However, in 2020, there was an increase in the number of TB deaths. And this just reflects what is happening in the global, which as mentioned earlier by Chris. So it's the first time that there's a increase in the number of TB deaths. Okay, so if we take a look at the data, it would show that tuberculosis affects the working age group. And there are more males than females. And most affected would be the 15 to 64 years of age. And if you notice, the violet here, or the magenta, would show the females, and then the greens would show the males, and the white or the light, or we'll say the gray part, would show the estimated number of TB cases. So this would show that we are still missing a lot of TB cases. Okay, then there's another study. This is done in 2003. And it would show that TB has a high human and economic cost in the country. there is a premature mortality due to TB, and it represents at least 9% of all potential years of life lost in Filipinos aged 10 years and older. And then the total annual losses to the economy associated with TB are 7.9 billion pesos in wages alone. And it affects the poor, elderly, and the male sectors of the population. When we did our 2016 National TB Prevalence Survey, it would still show that the TB still affects the poor, the elderly, and the males. Okay. So with those challenges, we came up with our strategic plan, and our vision is to have a TB-free Philippines. And our strategies now is focused on doing screening, testing, treatment, and prevention. And we still have our cross-cutting health system support, and those would include logistics management, information management, human resource management, and then including public-private mix. So we want to involve the private sector, since based on the National TB Prevalence Survey, about 1/3 of our TB cases are going to the public sector. Okay. So if we look closely at the cascade of care, that is from screening, our strategy is to maximize the use of chest X-ray as a screening tool. Before, we only use smear microscopy, and based on the prevalence survey, it would show that chest X-ray is more sensitive in screening the presumptive TB. So once we identify those who are presumed to be TB, we need to link them to testing and diagnosis. And what is good now is we're having new diagnostic tests. We have our rapid TB molecular test, and the test can already determine if you have drug resistance. Unlike before that we only use smear microscopy. And what is important here also is the private sector contribution. And we are asking the private sector to report their cases through mandatory notification. And for treatment, we are now using patient-centered care. So we are providing options to our patients. Unlike before that we would say that they really have to go to the health center daily. But this time we provide options. What is important is they take their drugs daily to ensure that they will complete their treatment and they will be cured. So we have introduced here a short all-oral regimen for our drug-resistant TB. And the services should be provided within the healthcare provider network. So it would mean that there's a functional referral of cases from all the health facilities. And this is aligned with the Universal Health Care Act. Okay. And then the next is the prevention. So it's not enough that we treat active TB cases. We need also to provide preventive treatment. And the good news is we are using, or we will be using, the shorter regimen. So that is 3 months compared to the initial 6 months regimen. Okay. So with that strategy, we committed to find 2.5 million Filipinos with TB and place them on treatment by 2022. This is the commitment of the country during the United Nations high-level meeting in 2018. So actually, we were doing good. Even in the first quarter of 2020, we really did a lot of case finding. And however, with the COVID-19, this has decreased. For 2021, we already assessed our accomplishment the first 2 quarters, and this would be the accomplishment if we would still be using or doing the same activities. So there would be a 600,000 gap from the targets if we will not be introducing new strategies and if we don't continue to find our TB cases. Okay. So what the companies can contribute to end this TB? So we are asking for your support that you also do screening, diagnosis, and treatment and prevention for your staff. So we are requesting that you screen using chest X-ray and symptoms, and to ensure that they are linked to diagnosis and to do also contact investigation. So what is important that this screening is being reported to the Department of Health, and once this is screened, they should be linked to diagnosis. So we use rapid TB diagnostic tool, as I have mentioned earlier. So we are providing free gene expert testing. As of now, that's the available rapid TB diagnostic tool that we have, although later in the last quarter of the year, so that is by November, we will be having additional rapid TB diagnostic tools. Then once that cases are diagnosed, we need to report them, and then we need to start treatment. For the treatment of cases, we want to or we are advocating that the NTP policies and guidelines be followed, so that it would be easy when we refer cases from the public to the private facilities, since we are using the same NTP guidelines. And what is very important is we also ensure that patients complete their treatment. It's not just reporting that we have the case, but ensuring that the cases completed their treatment. And the last would be to screen, provide, and TB preventive treatment, and to ensure completion of treatment. So this is the cascade of care, and this should be a complete cascade of care. They should be linked with each other. Okay, so for the TB in the workplace, so we are asking the companies to implement TB in the workplace and to report cases to the NTP. Our partner here would be the Department of Labor and Employment, and we have this partnership as early as 2003 with the comprehensive and unified policy for tuberculosis. Okay, so for us really to realize our vision of a TB-free Philippines, we want to follow this, that we need to keep moving forward. If you can fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you have to keep moving forward. So we need to keep moving forward despite the COVID-19 pandemic, because the TB bacilli keeps on multiplying. So that is all. Thank you very much.
Thank you, Dr. Garfin, for that. I know our attendees have learned so much from it. And I believe the companies present here have also learned how the companies can participate to end TB in the Philippines. So now may I call on our moderator for this event, our partner, Matt Oliver, the project lead from the Ending Workplace TB. Hi, Matt.
Hi, thank you so much, Dea, and thank you, Dr. Garfin, for the presentation. The National TB Program is really at the heart of everything to do with TB care and prevention in the Philippines, and there's a lot to do, but what you're doing is amazing. I also want to thank obviously our hosts at the British Chambers of Commerce and their partners, Dea and Chris, for helping put on the event, and the speakers, and of course you for giving up your time to attend. I'm going to speak briefly about Ending Workplace TB and why it was so important to us to host this kind of event. And then we'll hear from a panel, including Dr. Ruth, Dr. Lelaine, and Ms. Snyder, as Chris introduced earlier. So if you bear with me for just 1 second, I will share my screen. And hopefully everybody can see. So Ending Workplace TB. What is Ending Workplace TB? So we were an initiative founded by the World Economic Forum, the Global Fund, the Stop TB Partnership, and Johnson & Johnson to respond to those white or gray blocks that Dr. Garfin showed in her presentation. So every year there are around 10 million people worldwide who have TB, and more than 30% of them are never officially diagnosed and treated. And we know that most of those people are men of working age. And so when we were thinking about how we could close that gap, get more people diagnosed and on treatment, and therefore stop the disease, a natural place to look for those people was in the workplace. So our partners established Workplace TB, Ending Workplace TB. And there are basically two things that we do. One is that we have built a network of primarily multinational companies, some of them among the world's leading companies in the field of workplace health, in order to implement TB care and prevention programs in their workplaces and supply chains, and also share the knowledge of how to do that most effectively. But alongside that, there are a lot of initiatives already ongoing, some of which you will hear about in the next few minutes. And part of our role is to try and support those initiatives and do what we can to help them reach more companies and reach more people. And so in all of what we do, we are always trying to work in partnership with folks who are like national TB programs who are already doing a lot of work in the field of workplace TB. So this is our current membership. The list is small but mighty. We only started recruiting companies 6 months ago. So although we were launched in January 2020 at Davos, the COVID pandemic, like with so many other initiatives, caused a slowdown, and we're just kind of getting started. But as you can see from that list of companies, if you're familiar with any of the names, they're very cross-sectoral. You know, it's not just about pharmaceutical and biotech. You know, we have mining companies, we have financial services, we have logistics companies, and so on. And the reason for that is that we believe that every company can do something. And also, directly or indirectly, every company is affected by, if not TB, but certainly respiratory health. And as we know, the spread of respiratory pathogens in the workplace. And so we engage with our member companies one-on-one to try to find the interventions that make most sense for them, given their capacity and their context, and the things that they're doing already. So if you're on this webinar and you're thinking, well, I'm interested in supporting, but I don't know how, that shouldn't be a barrier to getting involved. We will find a way that makes sense for you and your company. So how do we do that? Well, the first thing is that we have a suite of materials that provide basic guidelines for companies who want to understand the challenges related to TB in the workplace. They are on our website and they are free. A lot of the interventions we propose have applicability for other health issues. So for example, if you have a strong and robust social protection scheme that everybody uses when they need to, as soon as they need to use it, that isn't just going to affect TB in the workplace, that's going to affect a lot of other issues. Secondly, we connect companies to expertise. So we work with obviously leading companies themselves who can provide advice, but we try to connect to national TB programs who, as I said, are the core of TB interventions in any country, and other technical assistance. So if you have the ambition to launch a big workplace screening program, we can help you set that up. And then obviously access to our network and the visibility that brings. So with the World Economic Forum and the Global Fund as partners, we're always looking for opportunities to showcase companies who are doing really great things. And one of the speakers, Ruth, who's going to come after me, is from one of those companies. So hopefully we can be successful at bringing awareness to the companies that are doing great things, because there is a lot of progress being made. And obviously, one of the reasons for holding this webinar was to try and invite new members to join. And so just to give you a quick overview of what you would be committing to were you to join, it's 4 relatively simple steps to begin with. So providing a focal point to join the network and really benefit from being part of that group of companies. Share best practice about what you're already doing to inspire others, but also to learn from others. And then use internal and external communications to raise awareness of the disease. And lastly, to engage suppliers about TB, especially those based in high TB burden countries, which is obviously particular relevance given that the Philippines really is one of the highest burden countries in the world. We will be following up with the people who registered for this webinar. But if you are interested and you want to reach out, you can always find me there. So that's who we are, and that's why we reached out to the British Chamber of Commerce and their partners to try and host this event. But we obviously want to tell you a little bit more about why TB would matter to you and what are already the interventions and programs going on in the Philippines that we at Ending Workplace TB hope to partner with. So without too much further ado, I will stop sharing And I will hand over to Ruth from Oxford Immunotech to take us through the next presentation.
Thanks so much. I will just try and share my screen. I don't know if it's allowing me to share slides. Do I need to be a...
Okay. Hopefully, Dea, could you, you are listed as a co-host. Hopefully it should let you.
Okay, try again.
One thing I should mention, just while Ruth is getting her presentation set up, is that at the end of the presentations, there will be a brief opportunity for a question and answer session. Some of you have already sent us questions, which we're going to kind of work through. But if for others, please feel free to post them in the chat, and we will do our best to answer them, or if not, follow up with you afterwards. Ruth, over to you.
Can you see the slides now?
Yeah, absolutely.
Great. So thank you so much for inviting me to speak here today. My name is Ruth Brignall, and I work in the Medical Affairs Department at Oxford Immunotech. And Oxford Immunotech is a company it's a diagnostic company, and it offers a test for the diagnosis of latent TB infection. And as Matt said, Oxford Immunotech and our parent company, PerkinElmer, are members of the Ending Workplace TB network and are committed to ending workplace TB and taking that step towards eradicating TB permanently. And I want to talk to you today about the importance of testing for TB for companies and the benefits that it could offer. So, as we've already heard today, tuberculosis or TB is a continued threat to global health, and it has really alarming facts. So it's thought that 25% of people in the world are living with latent TB. And in 2019 alone, 10 million people became sick and 1.4 million died. And we know that that number sadly rose during last year to 1.5 million. And if these current trends continue, by 2050, it is predicted there will be 31.8 million deaths alongside welfare losses of up to 17.5 trillion US dollars. And the real problem with TB, as I alluded to on the last slide, is that active TB, the TB that we can see that makes people sick and spreads in the community, is really just the tip of the iceberg. And an estimated 1.95 billion people have latent TB. And this is a form of TB that has no symptoms, it's not making people sick, and it can't be passed on. But in 10 to 15% of people with latent TB, that TB infection progresses to active TB, which causes the symptoms characteristic of TB, like coughing, coughing up blood, weight loss, and chest pain. And in those 10 to 15% of people, they're getting very sick and spreading it to other people, their household contacts, people in the workplace, anyone who they come into contact with. And this is really why the World Health Organization identified that the programmatic management of latent tuberculosis infection in populations most at risk of developing TB remains a critical activity to disrupt Mycobacterium tuberculosis transmission. So why is finding and treating latent TB so important? Well, ultimately, treating latent TB helps to eradicate TB. As I said, 10 to 15% of the latent TB population will progress to active TB, and treating latent TB before this point helps to prevent transmission and ultimately ends TB. Treating latent TB is also much less costly than treating active TB, and it involves much shorter treatment regimens. So why should companies care about TB? The real answer for this is that TB may be present within your workforce. And in fact, 75% of TB victims are in the most economically productive age group of 15 to 54 years. And without testing for TB, you would never know if latent TB was present within your workforce. Research that's been conducted in offices has shown that even one case of TB can result in up to 50% of the entire workforce being infected. And this can have a huge effect on the workforce and the functioning of the company. People affected by TB are around 20% less productive than their healthy colleagues, and they can lose up to 180 days of work prior to diagnosis, then following diagnosis must take time off to isolate. And overall, Ending Workplace TB estimate that a single case of TB could cost a company between 6 to 40% of an employee's annual salary. But the good news is that there are some real benefits to identifying TB in a workforce. And this is true across a whole range of different industries. So not only will it save lives and promote a healthy workforce, as I mentioned on the previous slide, it will also increase productivity. You won't have people coming in who are sick, spreading the disease around and passing it on to other people. In turn, that reduces workplace risks. But there's also some cross benefits that are less well known. Taking interventions to prevent the spread of TB could prevent further outbreaks of other respiratory pathogens in the workplace. And this is particularly important when we think about the disruption that's occurred over the last year and a half in terms of preventing future pandemics and outbreaks of other respiratory pathogens. And finally, what it really does is provide resilience within your workforce, but also shows that you're a company that's developing a workforce and a culture that's inclusive, progressive, and supportive. It is possible to stamp out TB with an effective and accessible testing policy. And there are two main ways of testing for latent TB infection. There's the tuberculin skin test, or the TST, which is one of the oldest diagnostic tests in existence, and one of the huge advantages of it is that you can test people just about anywhere using this test. However, there are some limitations. It requires multiple visits to the clinic, which can be disruptive to people's lives. There's a high number of false positives in patients who may have suppressed immune systems who aren't always easy to identify. Latent TB cases can be quite frequently missed and then potentially are at risk of progressing to active TB still. And also it cross-reacts with the vaccination for TB, which is the BCG. There are alternatives, and the main one for latent TB infection is the TB blood tests or interferon gamma release assays. And these require just a single visit to the clinic. They're not affected by BCG vaccination, and they're highly sensitive and specific in picking up those latent TB cases so that they can be identified and treated before they progress to active TB. As I said, both Oxford Immunotech and our parent company, PerkinElmer, have joined the Ending Workplace TB Network. And what we're really there to offer is advocacy, medical education around TB, and access to screening expertise. And some of the work that's already happening within the Ending Workplace TB Network is really exciting. So we've been working with our parent company, PerkinElmer, to develop advocacy and education plan, including hearing patients' voices and raising awareness in our workforces, developing case studies, and reaching out to other members to discuss the potential of carrying out screenings. And really what's clear is that both companies are truly committed to ending TB in their workplaces. So in summary, what I hope I've shown you in this very short talk is that it is in every company's best interest to test for TB infection. And by taking these steps to end TB, we're really helping to eradicate and end the global epidemic of TB. So I will stop sharing now, and thank you so much for your time.
Thanks so much, Ruth. And yeah, I couldn't agree more. Every company has a role, and I think that the diagnosis of latent TB plays into something Dr. Garfin said earlier, which is that the Philippines has the target that was agreed at the UN high-level meeting in 2018. And there is a latent TB infection and treatment target under that high-level meeting agenda as well, to which all countries are committed. And certainly every company has a role and to contribute to the NTP's national strategy. We're never going to hit those targets unless everybody who has an interface with people who might be sick with TB plays their part. So thank you so much. We'll come back to you for questions in a little bit. I'm now going to hand over to Dr. Lelaine, who will talk to us about some of the projects that are already going on to help companies tackle TB in the Philippines. Thank you, Dr. Lelaine.
Yeah, thank you, Matt, and also for the opportunity to share what we have been doing under the project. So can you see my slides?
Yes,
Yep.
Dr. Lelaine.
Okay. So I will be sharing with you some practical opportunities towards TB-free workplaces. And I believe the companies here might be interested to know and perhaps also participate in the initiatives that we've been doing. I would like to start with this very major reality about TB, the stigma and the barriers to care-seeking behavior. And I think this is the reason why TB remains to be there and very prevalent. We really don't talk about TB as much as we talk about other diseases. Stigma is very prevalent. Even TB survivors would rather keep quiet about their disease in the past, and the perception of having TB is really very low. And this translates to the reality that we had when we had this prevalence survey in 2016, looking at the health-seeking behavior among persons with already symptoms for TB. 41% did not do anything. 40% self-medicated, and 19% actually sought care. And if you look at this, the reasons for persons who did not do anything or self-medicated is because they thought symptoms were deemed not significant. They thought it was costly and it was time-consuming to go to the healthcare provider. So I think these are the reasons why TB is still prevalent. Misconceptions, stigma, and fear. And I think this will be addressed by promoting health-seeking behavior, especially in the healthy workforce. We are talking about quality screening for the workforce. So it's important to actually maximize our pre-employment and our annual physical exam activities in the companies to be able to screen our workers. There's also a problem of equitable access to rapid TB testing. It's a common behavior for doctors to diagnose TB just by looking at an X-ray. But it's equally important to proceed to bacteriologic testing to confirm if already are dealing with resistant cases or not early on. And I think what important factor here is the treatment support that is worker friendly and that they'll be able to comply with treatment. I think one message here is the workplace is like a home for most employees because they spend a significant portion of their day at work. And there's the presence of facilities, services, and personnel that will track their health behavior, including easy and convenient implementation of any health promotional activities. And monitoring can also be done in the workplace. So if we have an index case with active TB, then the co-workers may be potential close contacts to develop TB as well. And that is what we see in the workforce. We look at the risk factors present in our employees. We also look at the work environment where they actually spend most of their time at work. And these are the risk factors for certain employees or companies that are high risk for TB. If we have a workforce that is more than 200, predominantly male, high percentage of workers belonging to low-income strata, and high number of workers in production exposed to chemicals and dust. Now, TB in the workplace really makes sense because through this program, we provide worker-friendly initiatives to increase awareness among workers, to help them access patient-friendly and quality TB services. At the same time, we link them to notification in these engaged facilities. These are the existing policies for TB in the Philippines, and the salient features there are what I mentioned about TB advocacy, education training, referral to TB facilities, improved workplace infection control. And these are required for workplaces in the private sector as part of this latest Republic Act 11058 that was released in 2018. So what is the business association model framework that we have been pushing? This is actually engaging organizations or networks, and we actually partner them or team up with the Department of Labor and Employment and the regional counterpart of the Department of Health, and of course the local government unit where they can avail of free TB services. And in this circle, in the center is the worker. And this is what we call the constructive engagement in the implementation of TB in the workplace program. So when we talk about the world of work, of course, we focus on the formal workplace, but we are also aware that they are also in the supply chain providing support to the formal workplace, but may not have benefits And of course, we are talking also of the informal economies that we encounter as we go to work. So we hope that we provide access to these different types of workers, be it private or public facility with quality TB services. So in the past 2 years, we have been engaging business organizations to work with us to conduct forum and dialogues to improve TB in the workplace implementation. Some training needs assessment, ongoing training development that we are actually doing now, targeting the health personnel and safety officers. At the end of the day, we would like to promote healthy behaviors, appropriate diagnostics that should be requested of workers, and then to adapt TB education materials. So if you see here, the TB Free PH hashtag is a campaign, a national campaign that we already are also implementing in the workplace. So working to be free starts with good screening. And we know that if we do good screening, 90% of those can be detected on X-ray. So for companies who partner with facilities, make sure that the company or the providers you have are actually providing quality X-ray services. We also have to address those that may develop symptoms in between annual physical exam. And this better health-seeking behavior when symptomatic should be promoted. So these are just samples of posters that we are sharing with workplaces so that they'll be able to educate their workers about when they have to seek consult as potential or presumptive TB. So we also have developed this online TB self-assessment tool. It is easily downloadable. You can visit www.tbfreeph and or click this link, and you can start the test. And the persons who navigate through the platform would be able to know whether they are at least for TB and they should proceed with X-ray already, or should proceed with consulting a care provider and most probably submit a specimen for sputum. Now, this is something that we would like to actually change in the behavior in the workplace, because most doctors really rely on X-ray heavily, but they fail to correlate it clinically. So as part of diagnosis, as mentioned by Dr. Garfin earlier, we are now promoting rapid TB diagnostic test as the primary confirmatory test for TB. That is on top of X-ray. So this is a poster that we have developed telling our coworkers to undergo some TB testing to confirm whether they have TB or not. Of course, these services are free in public health systems, but I'm sure for companies in the audience, you have your own HMOs or your health maintenance organizations that may not be used in health centers. So one of the initiatives that we have done is to create a consortium of private laboratories and hospitals to be able to offer the gene expert testing. That is one of the rapid diagnostic tests that we are recommending at a lower cost, from a 8,000 average to about 72% reduced price. So this would be something that will be more affordable to the working population. So we have to click just this link to be able to know which laboratories belong to the consortium, so that your workers will be able to avail of the better pricing or a reduced pricing. So we know that TB is highly curable if detected early, and it is free, but it has to be completed. So we have developed posters to remind employers and employees that they have to complete treatment. But in completing treatment, it's 6 months at the minimum. Through the National TB Program Adaptive Plan for COVID pandemic, they have now started to shift to community or home or even work-based treatment arrangements, providing 1 month supply instead of daily visits to the health centers. Some private clinics would offer flexible clinic hours to look at our patients, and there are already new tools to adhere to monitor treatment adherence, like video, hotline, and also use of the SMS. We also have, of course, initiatives to make sure that cough etiquette is not enough. As mentioned earlier by Ruth, we have to also promote preventive treatment in the workplace. So it's important to identify who among the employees with TB and the contacts would be eligible to to receive TB preventive treatment. And this is actually free in government centers. So at this point, we actually categorize companies we engage depending on the workplace TB program that we have. And for the companies here, you might be labeled as bronze if you're doing the very minimum TB in the workplace program, or you can be considered platinum if you are doing more than what is expected of you. So we have also promoted this one-stop shop active case finding, where we partner with informal and formal workplaces that are high risk, that have high risk for TB, where we offer mobile X-ray that is equipped with artificial intelligence. We'll be able to know in minutes if you have suggestive findings of TB on X-ray, and immediately collect sputum for rapid molecular TB testing. And in this, we'll be able to shorten the time for treatment initiation among individuals that were screened. So what are the other products in the pipeline? We have e-learning training platforms that we can offer to your companies. We also we are developing web-based TB client reporting and monitoring platform. And we actually help companies establish linkage to quality TB service centers, and of course share whatever TB-free communication resources that we develop. So this is one of the policy of the National TB Program, the patient-centered TB care, by allowing respect and actually putting premium to patients' physical comfort and safety, and that we can also translate to the worker. So thank you very much, and happy to be in this panel.
Thank you. Thank you so much, Dr. Lelaine. And is there anywhere or anybody specifically that a company should contact if they want to explore engaging with TB-free?
Yeah, so we have, I think, one of the next speaker, ECOP. We have partnered with ECOP, so you can reach out with ECOP. And our partner for the TB in the workplace is Innovations for Community Health. I will be gladly sharing the details to your point person, should there be any companies interested.
Fantastic. Great. And I would just say that any company that is engaging locally, if you wanted to also join Ending Workplace TB, all of your obligations under TB care and prevention could be done in partnership with Dr. Lelaine and the initiative she outlined. So there's no reason not to do both. And lastly, I'm just going to hand over to Ms. Snyder from ECOP, as Dr. Lelaine just mentioned, to make some remarks. We will then have hopefully a little bit of time for questions, but if not, we're going to try and follow up with everybody who's proposed a question by email to at least give you an answer for the question you posed. Over to you, Ms. Snyder.
Hi, good afternoon, everyone. Sheila, can you share my slide? Okay. Are you now seeing my slides?
Yes.
Yes.
Yep.
All right. Fantastic. Okay, so I'm going to present the ECOP, that's Employers Confederation of the Philippines, TB or Tuberculosis Control and Project. So next slide, please. Okay, so a little bit about the organization. ECOP was born on September 10, 1975. It is considered a single voice of Philippine employers. It takes the lead in consolidating and articulating the employer's interests, especially in matters of concerning labor management relation and socio-economic development. Our international affiliation includes the International Organization of Employers, the Confederation of Asia Pacific Employers, and the ASEAN Confederation of Employers. So ECOP recommend policy proposal at the regional, national, and international levels. It enhances professional and ethical management practice standards. It also encourages and ensure the success of the tripartite consultation machinery. It promotes corporate social responsibility and enlightened self-assessment or responsible business conduct. And of course, assists our constituents in continuously strengthening labor management relation. So our services includes members general meeting, executive labor updates, especially if there are new policies. We have this copyhan or copy with the members. We have technical seminar workshops. We have overseas technical scholarship, and of course, we have a variety of networks. Okay, so we also offer public seminars, business cases on good practices on workplace. We have publications. We have, of course, one of our platform is the website, info notes and advisory, and we have just launched the ECOP Help Desk. So as mentioned by Dr. Lalaine in her presentation earlier, it was in May last 2019 when ECOP entered into a memorandum of understanding with TB innovation and health system strengthening project. And actually, it's not the first time that ECOP implemented such program. I think early on 2006 and 2007, we have already implemented TB in the workplace program. Next. So next. Yan. We have the TB forum and signing to enjoin more companies, and of course to show the commitment of our leaders as well. Okay. In doing so, we also engage our national tripartite partners, including DOLE, the Department of Labor and Employment, and of course, our friends from the trade union movement. So what we are doing, we have quarterly meetings to discuss TB issue and TB-related activities in the workplace. So who are the technical working group members? So as mentioned, DOH is there, the Department of Labor and Employment is there, representatives from informal and formal labor groups are also there, and of course, some business organization as well. So we have already conducted the online survey or quadratrix, and 75 enterprises actually among ECOP members participated in the survey. This includes their responses, if they have ongoing program on TB, if they have policy, and what's their take on the TB in the workplace program. Okay, we also engage multi-sectoral partnership because we know that it's a huge task and we need more partners. So that's in December last year. So we also have the Usapang OSH or the Occupational Safety and Health, TB in the workplace under our ECOP OSH network. So it was pretty much a success because a lot of people are now interested in joining TB program because it has the same symptoms with COVID-19. So yeah, attendees were ECOP members, CSR, ECOP OSH network members as well. And basically we just discussed the result of the baseline survey conducted. And then we also presented what are the next steps of the project, like project activities, the trainers training on TB. So we have just approved the TB TOT or the training of trainers training module. It includes the following topics. The first one is, of course, rationalizing TB program in the workplace. We will also discuss on national laws and legislations on TB. As Dr. Lalaine mentioned, the Philippines recently passed a new law, and it includes TB in the workplace. Focus on TB and national program in the workplace. And then, of course, we would like to assist company in preparing the training implementation plan in each of the enterprises. We would like to conduct trainers training on TB, and we actually want to do it in 3 batches. And of course, the development of business cases and TB protocols in the Philippines, people would, our members would like to benchmark on the good practices of other organizations, how they do it, what are the challenges, how they overcome it. Okay. So we will also provide a platform to discuss TB in the workplace through existing OSH network within the ECOP. And we will continue partnering with relevant stakeholders to provide information around the issue of TB in the Philippines. I think that's the last slide. Thank you very much for the opportunity.
Thank you so much for your presentation and for everything that ECOP are doing. It's a lot of work.
It is.
So we have had a few questions come in. Just want to check with Dea where we've got a bit of time. So I'll go on with the questions, and Dea, interrupt me if we need to draw things to a close. Thank you. The first question that we've had come in is a little long, and I think I'll go to Dr. Garfin first. If a person has had TB in the past and was treated and cured, does it make them immune to infection? What is the likelihood that they will get TB again? And can they then have latent TB, and should they be treated? So kind of 3 questions in one there.
So, Matt, can you please repeat the
yeah, sure.
Yes.
So question part 1, if a person has had TB in the past and was treated and cured, are they immune to future infection?
No.
What is the likelihood they will become ill again? And can they get latent TB? And if so, should they be treated?
Okay. So you are not immune, no, for TB. You are not immune. You will still, once you are sick with TB, there's another chance that you will have another TB disease. Even if we have the BCG vaccination, you will still have the chance to be infected or be having active TB. And then the next is...
what is the chance of them being reinfected? Is it higher?
Okay. So actually it would depend on your immune system. Like for example, if you develop or if you have no HIV, AIDS, then there's a 50% chance that you will have TB, or your TB infection will be activate to TB disease. But if you are a healthy person, there's only 5 to 10% chance in the whole lifetime.
Okay, great. Thank you. I think you also covered the latent TB point there, so I think we're good. Okay, on to the next question. This is for, I think, primarily Ms. Snyder. What are the biggest challenges companies face when implementing TB programs in the workplace? Dr. Lane as well, but I'll go to Ms. Snyder first.
There are a lot of challenges right now when it comes to implementing a TB program in the workplace. First, they need more leadership from the top. And then, of course, it talks about capacity as well. Like they wanted to, but they don't have the capacity to do so. And sometimes the cost of implementing TB in the workplace, because right now we're still in the middle of pandemic, and people would prioritize more COVID-related projects.
Okay, yeah. Dr. Lalaine, do you have anything to add to that?
Yeah, basically we tailor fit the approach based on the capacity and the resources available in the workplace. But the very, very important opening here is to link them up to free services already that are very available. So linking with government facilities and services is already patient friendly. So it's just a matter of linking companies to their services. And it will not cost much. Back to you.
Great. Okay. Yeah, that makes sense. So there's obviously a lot already going on that companies can do. Related to that, what are the overlaps between how TB and COVID-19 risk could be managed in the workplace?
Well, I can answer, or perhaps Dr. Celine answers first.
Shall I repeat the question, Dr.
Answer
Gaffney?
first.
Okay. Well, COVID and TB are both airborne infections, and they also are spread similarly. The risk factors also overlap. So we have diabetes, HIV, smokers, same risk factors for both TB and COVID. In terms of symptoms, it's also similar. Both would present with cough, with difficulty of breathing. So it's really very, it's an opportunity to integrate both TB and COVID testing and screening. So that's why in the workplaces, it's very important that as we test for COVID, because that's the appetite now for everyone, we also integrate testing for TB because it would involve the same diagnostic and screening tools. And that's when we identify both. We might screen out COVID, but you may be able to discover TB. In terms of infection control, it's the same principle, wearing masks. So I think that's the good thing about COVID. We understand and we appreciate the use of masks. Pre-COVID, nobody would like to wear masks, but at least this time they're willing to do so. In terms of preventive, there's no preventive treatment for COVID, but for TB there is. So I think appropriate evaluation of patients and classifying their eligibility for TB preventive treatment is something that we can offer. Back to you.
Great. Thank you, Dr. Lalaine. Dr. Garfin, is there anything you would like to add?
None. Dr. Lalaine have mentioned. Thank you.
Okay, great. So a question just came in, and I mean, I think this could be for everybody, really. Now that working from home is the new normal for most companies, how do you encourage companies, or how would you recommend that they track possible TB cases within their employees?
I can answer that. Like companies nowadays reported that they have this even if they're working at home, they have to inform their supervisors how were they feeling at the moment. So I think that's one good protocol in still tracking if there are TB cases in the workplace.
Great, thank you. Dr. Lalaine or Dr. Garfin or Ruth, anything to add to that?
I think there's an annual examination for the workers. So that's also one way of tracking if they have tuberculosis. And aside from that, no, I agree with Ma'am Dang Snyder that we can also have the tracking of the symptoms. Actually, we call it surveillance. So if there are workers that would have the 4 key signs and symptoms like cough for 2 weeks or more, fever, weight loss, and chest pains, then we can have them as presumptive TB. And we can do chest x-ray. But I think commonly they will be detected when we do the annual chest x-rays. Over.
Great.
Nothing further from my side.
Well, I was just going to ask, you mentioned that there is an app or a web portal to help with screening. Is that something that you would suggest that employees could use?
Yeah. So for those who are afraid to go out, avoiding exposure to COVID, we can already use technology. So the online self-assessment tool would let the person navigate through the platform and be able to know whether they will be referred to diagnostic tests, or they can also be referred to nearby diagnostic facilities because it's geo-mapped. So this is something that is very useful. And of course, we have already platforms for telehealth where patients can consult for those who are still afraid to go to the health facilities.
Great, thank you. So I've just been told I have 1 minute left, so I'm going to take the chair's prerogative and pose one last question to you all, which is, if you had a final message for everybody who has joined the webinar and for those who registered but weren't able to join that we could send out, what would it be? And I'll go in the order that you spoke. So Dr. Garfin first.
Thank you, Matt. So for the Department of Health National Tuberculosis Control Program, we would want the companies to implement TB in the workplace, and we would want them to report the number of cases that they have. And it's not just reporting, but ensuring that cases identified really complete their treatment. And as I have mentioned earlier, it's not just providing treatment for the cases, but ensuring that we also do contact investigation and provide preventive treatment. So that's all. Thank you for the support.
Great. Thank you. Ruth?
I would just say that hopefully what we've tried to get across today is that the benefits really do outweigh the costs of finding and treating TB in the workplace, and really kind of instilling that positive culture in your company and in your workforce. It has huge benefits, and it really is in the best interest of every company to go through that process.
Great, thank you, Ruth. Dr. Lalaine?
Yeah, I think I would like to focus on the stigma around TB and the reason why people do not come forward because they're afraid to lose their work or they're afraid of discrimination. So I think TB is something that we need to talk about now. And then we have to show compassion to patients who have TB. And then I think in making this conversation openly and in making the system support for these patients, we address the ability to really allow our workers to access these quality services. So that's my message.
Thank you. And Ms. Snyder?
I think it's about time to recognize that TB is a workplace issue. And we are calling to our constituents to implement TB in the workplace, not just because it's in the law, but it could be part of your corporate social responsibility as well. So those companies who will be interested, you just contact us through the www.ecop.org.ph. Thank you.
Great, thank you. And one last word from me before handing back to Chris, just to follow up on what Dr. Lalaine said. I think because TB is stigmatized and it's not something that people talk about, there is, we speak to companies all the time who say, we don't have any TB in our workforce. And we say, how do you know? And you just don't, you need to kind of look for it, and then you can address it and build the kind of culture where people are happy to talk about feeling unwell or that they need time off. So thank you so much to the participants. The participants. Thank you to everybody who's joined, particularly to the speakers. You've all been wonderful, and I will hand back to Chris now to wrap us up.
Thank you. And Dia, is my camera on? Well, I think it is, but I don't know why. Hello, Dia?
Yes, Chris, your camera is on.
So first of all, thank you very much to everybody involved. I'd like to first of all say thanks to Matt for moderating. Thank you to all our speakers. That's Dr. Garfin, Dr. Lalaine, Ruth, and Miss Snyder. We've had a very interesting discussion. I think obviously we've highlighted today the critical impact of dealing with tuberculosis. And if I may just make this comment, and obviously it was linked because there was a discussion about COVID. I think it's also as we move through the stages and hopefully go from a pandemic to an endemic, where we are in some countries, that we start reinvigorating and focusing on curable diseases such as tuberculosis. And as I think it was mentioned, when the tests are done together, that could actually be a way of moving forward. I'd like to also thank our partner organizations again, who've been so supportive. That's all the European chambers that have been involved. So thank you very much. And on behalf of everybody, I'd just like to leave this point, if I may. As Matt has said, if you have questions, I'll try to answer it by email. But this should be a continuing discussion. And we at the British Chamber are happy to forward those questions or inputs to the respective people. And please follow our social webpage, follow our announcements. We'll continue to also work on and promote on this issue. On that note, I'd like to conclude. I'd like to thank everybody who's attended for their time. On behalf of the British Chamber, thank you very much. I'd like to wish everybody here in Manila a very good afternoon. For those attending from the UK, a very good morning. And we look forward to welcoming you at another event for the British Chamber. Goodbye. Thank you.
Thank you so much, everyone. We'll play a video from Dr. Lalaine.
Every hour, 3 Filipinos die of TB, a disease that is curable, with medicines that are given free in government hospitals, clinics, or health centers. And yet, the Philippines has the highest TB incidence rate in Asia, with 554 cases per 100,000 people in 2019. It is one of the 30 countries with the highest burden of TB in the world. A standing so alarming that you are even asked if you ever had TB when moving to another country. A standing so alarming that the Philippine government pledged to find and start on treatment 2.5 million Filipinos with TB by the end of 2022. Only by finding and treating as many Filipinos with TB can we set ourselves on track to a TB-free Philippines. But this track has gotten unwieldy amid the COVID-19 pandemic. As countries responded to the COVID-19 threat, other health programs were sidetracked. % from 2019 data, as community quarantine measures restricted mobility and limited access to health facilities. Filipinos with TB symptoms like 2 weeks or more of coughing, unexplained fever, weight loss, or night sweats are unable to seek immediate care. A modeling study estimates that if TB services remain severely disrupted, more than 100,000 Filipinos may die of TB in the next 5 years. The clock is ticking. We need to get TB care back on track. Fund TB. Ensure adequate national and local funding for continuous TB services. Report TB. Monitor adequacy of supplies and timely record all TB cases. Elevate TB advocacy. Talk about TB in social and mass media and make it a priority health concern. End TB. Resume case-finding initiatives as soon as possible and ensure treatment completion and adherence of persons affected by TB. Let us address the old and long-time TB burden as seriously as we have faced a new and emerging disease threat, with focus and urgency. If we need to declare TB as a national public health emergency, then let this be our call. Let not the next second, minute, or hour be the last of another Filipino with TB. Instead, let the next second, minute, or hour be the chance for a Filipino to live TB-free.